Can I begin by also acknowledging that we're on the land of the Ngunnawal peoples and pay respects to elders past and present. I'm from Darwin. My mother's Kungarakan and my father's Iwija, and so I spent a lot of time up there before moving to Canberra. But also I wanted to get at the very outset an apology that I have to leave immediately after speaking, or something I don't always encourage, but I'm convening graduations at University of Canberra this morning, so I've got to hit and run. So this is just a reminder of what we're talking about in remote Australia, and those little dots are all the communities, and I've worked in a lot of those, as mentioned, as chair of NINTI 1, which we manage this, the Cooperative Research Centre for Remote Economic Participation until recent years, and prior to that was the Desert Knowledge CRC. I manage on behalf of the government the National Tackling Indigenous Smoking Program, which is one of the big success stories in Indigenous health, where we have seen a reduction in smoking. Still a long way to go, but the rate that we're reducing at just over 2% a year is at a far better pace than it was for the general population, and do a fair bit of work around mental health, suicide prevention across remote Australia, and provide advice to government on that. I guess what I wanted to do today is not talk about a scientific approach to looking at health, but talking about some of the issues and challenges, and one of the potential solutions. I guess when we look at public policy development, one of the real challenges that we've got is that too often we're getting, and this is not just in health, but generally, fly-in visits from bureaucrats or researchers who will spend a couple of days in communities and come out as wise as they can be. And even worse than that is when people are just based in Canberra and make decisions on behalf of rural and remote Australia. And that's, again, for the whole population, not just Aboriginal and Torres Strait Islander people. But, and it's interesting because what we also experience is a real fair bit of kickback from the community saying that they're over-consulted. And that's one of the worst things, where you get consulted time in, time out, and you go nowhere. And it's not at least obvious to the community about what all the consultations are. And so the community gets very jaded and doesn't, in fact, participate in a real way. I guess one of the, a couple of the things we hear, and we hear the Prime Minister talk about it as well, the mantra of do it with us and not for us, and the government are very keen on that, or do it with us, not to us, and also work with us and not for us, which is important from an Aboriginal and Torres Strait Islander perspective. And now for this forum, where we're looking at 20 years of rural and remote research, health research, I think it's really important to look at how far we've come and where we're going to. And so I'm going to focus on a group which we call Aboriginal Community Researchers, and it's about how we inform policy and practice in rural and remote health. Now, we mentioned NINTI 1, which is NINTI 1 Limited is a not-for-profit company, but we have an Indigenous company called NINTI under it, and we do a lot of work in this area. I'm going to just touch on health today, giving a bit of a info about these researchers, but also just highlight some of the projects that we've worked on. I guess what Senator Mackenzie said, which was very important, is that as part of the Close the Gap, we've got to look at the determinants of health as well, and employment is one of those key determinants, as well as a range of other issues. And by employing these Aboriginal community researchers, we're able to really create a bit more employment within remote communities. And as this says, we've got over 250 Aboriginal community researchers working across 100 communities, and we've been doing this for a number of years. And these guys, men and women, have been trained in research methodologies and different approaches. But what's so important about it is that the research will be much more informed. The community-based people have a far better understanding about the history of the community, about the community itself, about the languages and about the cultures, which are really important aspects of looking at what we're doing. We work with a whole range of people from the corporate sector to the industry sector, governments and community organisations in the work that we do. And I'll touch a bit more on that, but they're just highlighting some of the communities that we work in, the majority of communities we work in. We really are keen on looking at a shared space and a partnership between all the parties that are involved, be it government, who are one of our big clients, but also the research sector and the community sector. And we recognise that in doing that, if we do work it as a partnership, there is a whole lot of shared space which we can work on, and our communities, our community-based people are the people that can collect that data and provide it. And the key thing is that it's the relationship that they have within the community that's already there, that doesn't need to be developed if you're an external person coming into the community, and or what we hear so much for and why there's a lot of inefficiency in research projects is that people will rock up to a community, but the people that they thought they were going to see aren't there,